What does it mean when you are out of alignment? What does a chiropractor look for? How can we tell? So this is going to be maybe a little unpopular with some of my colleagues, but I do not like that phrase out of alignment because there is really nothing that is out of place when it comes to your spine. So if you have something that is out of place, that's a dislocation and that is something that we cannot take care of. And I often will say sometimes out of alignment with my patients, and that is incorrect. Or a patient will say, "Hey, doctor, like, am I out of line today?" And I always joke with them and I say, "Oh my God, you're crooked today," which sometimes, yes, when you see a patient laying down, they will look like they are crooked because you will see asymmetry in their muscles, or maybe they are so tight on one side that you might see changes in their posture. So in my opinion, saying out of alignment is really old school thinking, whereas modern chiropractic is about establishing joint function. So what I particularly look for is not a bone out of place, but I look for areas in the spine that are not moving properly. So they are restricted in motion. So you may have areas in your pelvis, in your spine that just are not moving properly. And this can affect soft tissues. You can have inflammation. This can be due to muscle spasm or cause muscle spasms. This can also be due to stress, poor postures, or just regular activities in your life. You can have areas that are not moving properly and not necessarily have pain. So your spine is not like just one big stick. It's all made up of separate vertebrae. And if there's a particular area that gets stuck and you have many of those, then you might have global restrictions in movement, meaning as you'll have difficulty maybe turning your head from side to side and you feel stiff. So as chiropractors, we might check your muscle tone. We might feel our hands and palpate areas of restrictions in the spine. We might check your leg length to see if there's any changes in asymmetry. Look at posture, look at gait pattern, do muscle testing, check ranges of motion. So there are many different types of techniques out there when it comes to chiropractic, but when I'm talking about the traditional spinal manipulation, we're not essentially aligning the spine, but we're restoring joint function. So we're restoring proper joint movement.